Hi everyone, Tom Swells here at tomswell.com. Now I've got a request for a video on how to unkink a neck. Now some of you may have woken up in the morning and all of a sudden you slept awkwardly, maybe you're sleeping on your stomach, cranked to the side, and all of a sudden you can't turn your head. So few of the things I want you to take note is do not apply any of the things I'm going to show you in this video if you have very acute pain, meaning it's pain all the time. If you're kind of more stuck, then you can apply some of the things I'm showing you in this video. If you have numbness or tingling into the arm, burning, you don't want any of the symptoms. These are nerve compression issues. So you don't know what is compressing the nerve, so do not start stretching or moving into the neck until you have it assessed by an orthopedic specialist, physiotherapist, chiropractor, osteopath, whomever that you know in your area to properly get it assessed and then treat it from there. So this is for if all of a sudden you wake up and you're like, that's jammed up, yeah, that's sticky. If it's consistently, you cannot rotate or you're getting a little pinch on the same side that you're rotating towards, then some of these exercises can help alleviate that. So that being said, whenever you are looking at a neck issue, make sure that we're not stuck through the rib cage or the thoracic spine. If we're stuck here, then we tend to get a little hypermobile and we start to compress and jam up the neck muscles or the joints in the neck because the muscles are overactive trying to stabilize it. So always go after the thoracic spine first. And the way I like to do that, foam roller, sure lots of you have seen these or have these. You're gonna work just in the rib cage, thoracic spine exclusively. Find a spot where it kind of feels a little stickier. Place the hands behind the neck, protect the neck, keep your butt on the ground, and slowly let your shoulders fall around the foam roller. And as you move up, breathe in, exhale on the way down. Perform about 3 to 5 reps at each level. You might hear a couple little clicks, a couple little pops. That's okay as long as it's not painful. And don't move into painful zones. If you're going to a range where you're bracing and you're holding your breath or it's uncomfortable, it's too far. You got to work into that. And then recheck the neck to see if anything's freed up. Another way you can do is a little sitting rotation test and see if it's symmetrical left and right. If that's the case, if you feel like a little jammed up, take your foam roller, lay on your side, bring that hip and knee just past 90 degrees, and put a pillow underneath the side of your head or just use your arm if that's comfortable, and grab some lower ribs here. You're gonna take a nice deep breath in, exhale, and you're gonna lift those ribs towards the ceiling and try and pull that shoulder into your back pocket. Keep that leg pinned on it. Don't let that lift off. That's just gonna end up with rotation in your lower back. So do about 10 to 15 reps here to get some thoracic rotation going for you. And then recheck the neck. If that freed it up, great, awesome. You found what was causing the issue. Now, if you're still feeling a little jammed up there, you can use a lacrosse ball or acupressure ball, whatever you got, either in the upper trap or I'm going to show you also in the neck musculature. Stick it right on the upper trap. It's going to be a little tricky to get it there, but when you move that shoulder on top of it, the shoulder will roll and the trap will roll up on top of the muscle. And you can do some light head rotations here with some breathing to help free that up. And just go poking around and find out where the nasty points are. Now that trap attaches to the base of the skull. So bring it just behind the neck. Okay? You might want to use a bit of a bigger ball if you've got that. It might be a little bit more comfortable for you. But just put it on the musculature, do not put it on the joint. Don't put it in the middle of the spine and start cranking your head in extension. Just slightly put it here. Here you can do some chin nods and that will pin and stretch the muscles. It's also going to strengthen and activate the neck muscles in the front. If that doesn't work, get back on the foam roller and just use it as a pillow and then roll back and forth. So I can feel my left neck's a little bit more jammed up. I got a little bit more tension there. I have an old neck injury. So I'll just lay on that and just roll back and forth. I'll do some chin nodding. Put a little stretching through there. Put it on stretch, roll back and forth. And it's gonna take a little bit more time because the foam roller goes over a broader space and a lot more musculature. So you're gonna need to spend a little more time on here because of the less direct pressure. but it's a lot more comfortable for most people. So, taking care of the thoracic spine, taking care of some of the musculature. Check to see how that neck is rotating. If you're still getting a little pinch on that side, you can do a towel mobilization. You just take a nice hand towel, that works, any kind of towel works, and just kind of palpate wherever is kind of the most tension. Place the edge of the towel right across that tension, and the other one across, say, the jaw. And you're going to look, so you can do some active assisted range of motion exercises, but you're going to do a little bit of what's called a mobilization with movement. So you're going to look to the left, you're going to hit that end range, and you're going to give a little bit of a stretch. And I want you to use the eye musculature, so keep looking around the shoulder to train those deeper neck muscles to help facilitate some of the rotation that happens. So it's a neck, it's an ocular neck reflex that we have. Take a breath, come on back. Okay, so try 5, 10, 15 reps, whatever works, and then recheck your range of motion. Okay. You can work multiple levels, so you can work right at the base of the neck, or you can work it all the way, the base of the skull, and you can work it all the way down to the base of the neck. But the idea is the same, is you're gonna block the joint on one side, and you're gonna mobilize the upper one just above it. Okay, so if that frees you up, great. All of a sudden, now you took care of some of the joint restrictions, possibly down in the rib cage, took care of some of the muscle tension that's in the neck or the shoulders, and you did some joint mobilizations. If all else fails, but if it still feels a little bit jammed up, okay, some people will manipulate their neck on their own, where they grab their head and they don't do that. You can do a light stretch through traction and a light rotation. So what I tell people is just slightly turn the head, less than 45 degrees. You're gonna grab base of the skull and the chin, and you're gonna do some light traction. So you're lifting the whole head up, and you're just doing some breathing. You're not thrusting, you're not cranking, you're just tractioning in that little bit of a restricted range. So if you're a little bit more comfortable, okay? So just doing that traction is gonna release some of the muscles, and again, you might feel a slight little cavitation, a slight little pop. That's okay. So if I go this side, so I just felt a little bit of a cavitation here. And all I did was just slightly rotate. I just lifted, that's all I did. And it kind of freed things up a little bit better for me. So try these techniques, but go through that sequence. Make sure you're cleared out of the way here. Make sure you're taking some of the trigger points out of the way. Make sure you've worked on some of the soft tissue on the back of the neck to make sure that's not what's causing some of the compression. Feeling like you have a compressed joint, then go after some of the joint restrictions. So that's my recommendation, but like I said, don't do any of this stuff if you have any really acute pain, any nerve pain, which is shooting, electrical, burning, numbness and tingling. That is a more severe condition that needs to be assessed by a proper professional. Let me know if you have any questions. I hope this was helpful. Shoot me any messages if you have any other issues. Take care.